Thank you for the introduction, and I'm really excited to come through our next aspect of our curation. I'm just going to show you a few slides to introduce this particular section of our talk. And hopefully they're coming up for you as they are for me. But we're really just going to take some time to talk about some contributor perspectives here. And I am Courtney Thaxton, as I said, and I'm doing this on behalf of the ClinGen Community Curation Working Group. And I know that you all heard about some of the information with the opening slide that Sharon gave today about ClinGen as a whole and as a community, how many members we have. But I do just want to give you some dates and some metrics just from the Community Curation Working Group. We were officially formed in October of 2018, but we launched our survey in August 2018. So over the last almost 3 years, we have ended up reaching out and had over 900 individuals take this survey to indicate they had interest in participating and contributing to ClinGen, and they represent 61 countries. And so we can start to see over these last 3 years how far reaching that we have gotten for ClinGen and for those reaching out for interest. Just this past year alone, from January until now, we've introduced 11 new countries from individuals taking our survey, and those are represented in orange on this map and are listed on this slide. And of course, I always like to say it takes a community to train and support a community. The C3 really is here to help engage individuals to come and to contribute to ClinGen. We help facilitate training through our education, coordination, and training work group, as well as place individuals and curation activities. At this time, ClinGen really hosts 6 curation activities. They have the 5 standard you have known of, and we have launched recently our baseline annotation within the Community Curation Working Group. So I just give thanks to everyone who helps to support this effort to bring in our contributors. And we've also, just to give you some reports on training, have trained over 300 individuals to participate in our training sessions. And this is just for community interest alone, not including the training sessions we have for individuals of our expert panels that may have come with their panel. Over 222 have been assigned to a curation activity at this time. And as I mentioned, we did just launch our baseline annotation this past April. You can see the interest that we have in the figure over here that gene and variant are our highest numbers of percentages of individuals, but we certainly have representation from all 6 of these curation activities. So I'm really excited today to let you know about the panelists that we have that come from our community and contribute. They do represent each one of these curation activities or even multiple. And we'll just take some time to introduce you for their different perspectives. We're going to listen to individuals who have a student perspective. We're also going to listen to those who are laboratorians, clinicians, as well as some of our long-term and international contributors. So we'll just take some time for each part of these sections. But I do want to start before we go to our panelists, just to let you know a little bit in this word cloud about the motivations that we hear from our contributors. And then the highest one is that individuals really do want to contribute to precision medicine and health was our highest number that's ever entered, and for patient care. Many of you just want to have the experience and network, but you also want to be able to know you're contributing to the community and may even have personal reasons for why you're contributing. So we do thank you all for your motivations and for coming to contribute to ClinGen. And so I want to start off introducing you to 3 of our individuals and panelists that we will begin to ask some questions for. That's going to be Safa and Sar. You're also going to hear from Emily Groupman and from Megan Mayers. Great. And so if you all can take just a few minutes to introduce yourself and briefly tell us about you, what you're up to, and why you contributed to ClinGen.
Hi, this is Siebel. Currently, I am working at Quest Diagnostic as a senior director. Originally, I got my molecular plus cytogenetics training program at Harvard Medical School. And right after the graduation of the program, I got director position at Beth Israel Deaconess Medical Center. I was cytogenetics director about 5 years. Then I moved to California, UCLA, and I work as an associate director about 5.5 years. Then 4 years ago, I moved to Quest. So my first interest for the ClinGen started during the ISCA. So maybe I can talk about the details later on, but this is my general introduction. And currently I involve in the several working groups and expert panels, including copy number variation interpretation guidelines, dosage sensitivity curation, and subgroup neurodevelopmental dosage sensitivity. Thank you.
Great, thank you. And hear from Safa.
Absolutely. So it's lovely to be here today. Thank you so much, Courtney. And my name is Safa. I just graduated actually from the Medical Genomics Master's Program at the University of Toronto. And I'm currently working with Dr. Raymond Kim and the von Hippel-Lindau disease variant curation research team in collaboration with ClinGen community curation. So our team has extracted VHL variants from hundreds of clinical papers and has been uploading them onto CIVIC, which is the clinical interpretation of variants in cancer database. So now we've got the largest standardized open access database on VHL patient genotype phenotype data. And to expand our curation efforts this past year, my team and I actually developed the VHL disease community curation protocol through the Hypothesis platform. And we've trained the first VHL undergraduate community curators, and that's been going very well so far. And my personal goal for the future is to pursue a career in medical genomics and continue working in clinical genomic research.
Great, thank you, Safa. How about you, Emily?
Oh, hi, I'm Emily. I'm an MD PhD student at Columbia University College of Physicians and Surgeons, currently in my last year, finishing up the MD portion. I've been involved in ClinGen since around 2018. First got involved through the phenylketonuria working group, and then expanded to some other IEMs, as well as working in the kidney GSEPs once they got up and working, as my PhD focused on using exome sequencing for the diagnosis of rare inherited kidney disorders. I'm hoping to go into a career in pediatrics and medical genetics, pursue a residency there. And recently my ClinGen activities have involved, in addition to biocuration, making gene-specific guidelines for the phenylketonuria working group for usage of PVS1, as well as doing an IEM-wide survey to pinpoint difficult ACMG, AMP criteria, and then could discuss, create working groups to identify strategies to help better adapt those for IEMs, with the hope of making this into a greater ClinGen-led effort involving other groups as well.
Great, thank you. And how about you, Megan?
Hi, I'm Megan. Thank you so much for having me today. I'm a current student at the Case Western Reserve Genetic Counseling Training Program. I started with ClinGen back when I was an undergrad, so I started my junior year in 2017 just as an undergraduate volunteer, where I learned the annotation process under my mentor, Courtney. And then once I completed undergrad, I was hired on as a biocurator for the ClinGen Biocuration Core and have curated for groups of monogenic diabetes, Charcot-Marie-Tooth, as well as several metabolic groups, including peroxisomal and GAA. And now while I'm in school, I'm working part-time for the Biocuration Core, primarily with the monogenic diabetes group.
Great, thanks. I'm going to ask some questions of the students, and I will certainly introduce the rest of our panel as we run through this thing. So thank you very much. Just to hear from you all as students, just wanting to know what your experience was as a student in joining an expert panel.
I mean, I can start us off. So, I can say that it's been a wonderful learning experience. I think that's the first thing. You get exposed to such a great breadth and depth as well of individuals in all kind of roles in the genomics process, individuals, who have a primary basic science background, clinicians who are very skilled in the disease field, as well as individuals who are in molecular pathology or molecular genetics and are really aces at variant interpretation. And I would say that as a student, it's been great, and incredibly helpful and inspiring to see here are the different, here's so many different roles that one can take, in clinical genetics, and also using that to help guide, your own interests and pursue further projects. It's also been really nice to see how much support there has been for student initiatives, and I think student work, encouragement of, oh, this sounds interesting. Yeah, happy to take that on. So it's been a lovely experience so far.
Yeah, I'd just like to echo those sentiments. That's absolutely true. It's been amazing to see how much support there is for student curators and how accessible this type of learning at a genetic scale has been made for students who might not have a genetics background or who are just in undergrad, because community curation is something that is so accessible across skill levels and across disciplines. Personally, I've really liked working with the expert panel, especially when working with the ACMG criteria. One of our goals is to make sure that we meet the needs of the expert panel and the type of information that we're highlighting through our curation efforts. And I have a background in genomics, so I'm used to doing variant annotation and variant analysis. But one of the things that I didn't realize until I started working with the expert panel is how nuanced that really is for each specific disease, and learning how the ACMG criteria are really adapted and molded to the situation you're looking at. And so I'm really excited to see how clinical labs start bringing in that information to disease-specific scenarios.
Great. Thanks, Safa. How about you, Megan?
I'll also echo what everyone else has said. It's been a very valuable learning experience, especially coming from perspective as a now second-year genetic counseling student. I feel like it really did catapult me into being able to have a really good baseline knowledge from a lot of the groups that I was working in, especially with ACMG variant curation criteria that really, I feel like, put me at a little bit of an edge in terms of my first year of my education. And it was also just a really great experience working with experts and really honing in on skills and presenting to them and working with all these different experts in the fields that we are involved in.
And I have one final question for all of you all before we move to our other representatives, but what will you take from your volunteer experience for your future career? You kind of indicated how it helps to catapult, but thinking about where you will go with your future.
I mean, I would say a few things, among others, just of reinforcing and really deepening my love of medical genetics, which has led me to, I'll be applying this cycle for residency and to pursue a combined pediatrics and medical genetics residency. It also, I think, really just reinforced to me the great, kind of all of the value of having a multidisciplinary working group, the power that comes when you pull individuals with expertise from such diverse fields, and how that can really inform creation of, more specified guidelines, which can then really empower clinical variant interpretation with, of course, the ultimate goal of advancing patient care and, chasing that dream we called precision medicine.
Absolutely. And again, I just wanted to echo that, and especially the precision medicine point, because I think one of the biggest takeaways from this experience for me has personally been seeing how all this information is connected online, and looking at this as kind of like a linked data hub connecting information. We have ClinVar, we have ClinGen, and we have all these other databases that are connected through our efforts. And that's something that's so powerful. And working with all those databases, learning all of those new skills is something that I'm definitely going to take away from this, because it'll help me be a better variant analyst, a better scientist, and just, for the future of data-driven science and looking at machine learning possibilities, it really helps us get at that question of precision medicine and genetic-specific treatment and therapy.
My efforts with this group in ClinGen has really allowed me to appreciate the power of the collective effort that's involved in precision medicine and the impacts it can have even beyond just the field of genetics. So it's also I'm gonna carry along with me just more critical thinking when I'm applying this stuff, when I'm actually in the clinic and working with patients, once I'm actually there after I've graduated, and just thinking about things with a more critical mindset in terms of how we've actually interpreted these variants and what these might mean for patients moving forward.
Great, thank you all. It will certainly have you still here to answer any questions. So if any of you in the audience have questions for the students or any of our panelists as we begin to introduce them and ask questions, please put in the question and answer or in the chat. We'll try to monitor that for you. I'm going to just share my screen for one more second so that I can introduce our next speaker. And so I just want to take the time to introduce Jun Rao, PhD. He is the Laboratory Director of Molecular Genetics and Cytogenetics at Columbia University Medical Center, and is part of the Intellectual Disability and Autism GSEP. And Jun does represent our laboratorian and a contributor. Hi, Jun, welcome and for joining us today and being able to tell us a little bit about yourself and what brought you to ClinGen.
Hi, Courtney. Thank you for inviting me to share my experience. So I probably learned from ClinGen from beginning, but when I really seriously get involved, it's about more than 2 years ago. I think at one of the ECMG meeting, they have this ClinGen recruiting working group. So I was getting and get registered. So eventually was have to finish my training on the gene curation and eventually get work with, as you mentioned, the intellectual disability and the autism gene curation expert panel. And currently I'm also involved, just a shout out for this new established gene curation panel for the prenatal defects led by the Dr. Ron Webner and Jess Giordano. So yeah, so I'm very excited to share my experience and other with the group.
Well, that's great. So already going into different efforts for your contribution with ClinGen. So thank you for that. Now, being someone who is a lab director and coming in to volunteering and contributing to ClinGen, do you take any of the experiences that you have with ClinGen and apply them to your work? And even thinking about, does your laboratory use ClinGen curations when they think about the results or when you're pulling out different genes or variants from your lab?
Yeah, so that's a very good question. So I think there are several, opportunities or the thing I think we can use the ClinGen. I think it's really helpful for my both clinical duty and also, by the way, I'm also associate program director for the laboratory genetics or genomic training fellowship training program. So I think both for our fellowship training and for the clinical duty, it's very, very useful. So for example, I think like I'm working, for the routine clinical duty. One of the is assign out the whole exome sequencing, clinical whole exome sequencing, like a lot of other laboratory directors doing. I feel like it's at least a few chance that when I sign out a clinical case, I realize the gene it's in my final list. Actually, it's the one I curated or my group curated previously. So it's really making me confident, like this gene association, because I really know the well study on the gene, all the publication about the gene. So that's, I think, definitely the first one, and I think is really important. And the second, I think sometimes we will build a new, like a disease specific panel or the gene panel. I think now I think the ClinGen is really very useful resource. We will look at the ClinGen. I think we look at the OMM or the what's the panel offered by the other lab. But right now, I think the ClinGen is also very, very useful resource. We will look at the ClinGen, and if it's a definitive, a disease association, obviously they definitely should be in our panel. But if it's like a limited or disputed, obviously we should think it again. So that's, I think, another very useful way to use the ClinGen. Last, like I mentioned, I think the ClinGen provide a lot of very useful training opportunity and materials. I think because I'm mostly involved in the gene curation, right? So I feel this is kind of a little bit lack of training compared with variant curation, because variant curation, we know the ACMG guideline it's been out for several years, and almost every lab I think use that. But for gene curation, I think it's still like the area relatively new. So I think I've been involved a lot of this training material for gene curation, and even for the variant curation, they have a lot of updated guideline for the specific rules. I think is also very useful. So. And also we have this monthly biocurator meeting conference. I think it all provide a lot of training opportunities. So I think not only myself, my colleague, but also including some of our fellows also actively involved in this ClinGen curation and training. Yeah.
Oh, that's great to hear, especially with our training and, getting to the outreach and being able to maybe even supplement what's going on within your lab and even your training program that you have at your university. And so one of the things being a laboratory director and, heading up this fellowship, how do you make time to volunteer?
Yeah, I mean, time is always an issue, right? So I think in generally, like our for our, I guess different institute have a different, like for our institute, normally like 75% of my time is most involved the clinical duty, and the rest of the 25% of the time is for the research, education, like teaching, training. So obviously I can use that 25% of my time for the ClinGen curation purpose, but obviously, sometimes it's taken more than that. So obviously, I need to use my personal time sometimes. And yeah, I think it's really, I think the challenge for everyone. I believe, everyone is busy with all different kind of their responsibilities. And one of the suggestions I will have, after my several years experience, I feel is I feel it's better to save a chunk of the time to work on it, rather than split it into different, small time, because I feel sometimes, you're gonna forget what for example, I read some paper, I did some curation, but after several weeks, when I have time to go back, I have to redo it again, reread the papers, right? So I think it's better to focus, save, a whole day, or like at least several hours to focus on that, get it done. I think that's probably the best strategy in the long term to save your time. Yeah.
Oh, that's some great advice to give about that. And also, you kind of indicated that sometimes it sounds like your institution may support some of your work on some of the things, but is there anything you think ClinGen could do to make contributing to our expert panels or working groups more integrated with your work, or more accessible or easier to participate?
Yeah, I think honestly, I don't have too much I think everything ClinGen pretty much positive, right? So I really don't think, I think they did absolutely their best to help, to make the curator do their, easiest way or the most smooth way to finish their curation. But the only one thing I feel is I feel I do spend more time on the GCI, the gene curation interface, because obviously we need to put a lot of the information into the GCI to, every detail of the paper. So that do take, sometimes, but I saw the software is improving, from different version to the new version. And I know they will release a next version very soon, so I'm looking forward to see the changes, so hopefully we'll make everyone's work much, at least easier or the more accurate. Yeah.
Well, thank you so much for that feedback, June, and we'll move on to some of our other panelists, but we may bring you back on later for questions and answers. But thank you again for your time and for providing that feedback and perspective. And just to move on, we're going to go and talk with our clinician contributors here. And I'd like to introduce Rashmi Kananda-Shamana, who is the director of the Clinical Microarray Facility at the CLIA Certified Molecular Diagnostic Laboratory. And I'd also like to introduce Andrew Strakakis, who is the assistant professor in medical genetics at the University of Washington. They participate in somatic cancer and the actionability working group. Thank you both for joining us today and for helping to bring us a perspective from a clinician. If you all can just briefly tell us about yourselves and your volunteer experience, just where you currently work and what you participate in, and just how you found this opportunity in participating.
Sure, I can start off. So I am Rashmi Kanagal, and as Courtney mentioned, I am a board certified hematopathologist and a molecular pathologist at the MD Anderson Cancer Center. And so most of my work, my clinical work, is clinical development of NGS assays and interpretation and sign out. So it's kind of, and in addition to that, I also sign out bone marrows, lymph nodes, and make other diagnoses and kind of correlate with the molecular results. So essentially the work of ClinGen is kind of integrated. I guess it's kind of a mixed, the distinction is kind of very blurry, right? So the first time I heard about ClinGen was in the Cancer Genomics Consortium meeting. And when I believe there were several presentations from the ClinGen group, and that kind of fascinated me that there is this resource, immense resource out there, and also that we could actually contribute to it. And that's when I joined ClinGen. I am now co-leading the hematologic malignancy task force, which is under the somatic cancer CDWG, and I think it's been a fantastic experience. It's been close to 2 years since we formed the Heme Task Force, and my co-lead and my coordinator, the whole team, everyone has been super enthusiastic. I think the momentum is like super high right now, and I think the monthly meetings when we have, it's just the ideas that come around, the ideas bounced across, and those really kind of are very stimulating and motivating, and it kind of motivates me to work here, and what I do here kind of motivates me to go back to ClinGen. So I think it's a very it's a great experience.
Thank you, Rashmi. How about you, Andrew?
Yes, so I'm Andrew Sturgachs. I'm an attending physician and assistant professor over at the University of Washington in the Department of Medicine, Division of Medical Genetics. And I see patients both in the adult genetics clinic as well as in the adult cardiovascular genetics clinic. So I've actually really enjoyed volunteering. I initially started off as a community curator for the adult actionability working group. And I started this actually during my training as a fellow and resident at the Brigham and Women's Hospital, Harvard Medical School, when I was doing internal medicine and medical genetics training out there, and really found this as a sort of a great opportunity to sort of what a lot of the students were talking about, in the prior session, to sort of augment your education, learn a little bit more about conditions that you don't necessarily see as much, as well as, think critically about the actionability of conditions which you may see actually more frequently throughout that time. And as I transitioned from training now to attending, I've continued to be a volunteer within this community curator for the adult actionability, and just recently switched over to becoming a member of this group in the past month. And I've just really enjoyed it. It's just a fun opportunity to sort of engage, and as well as to learn more about, like I said, conditions you don't see that much, as well as just really think critically about other ones.
Well, that's amazing. And, thinking about that, both of you are clinicians, and you kind of talked about a little bit about how your work can overlap, but I wonder if you can expand a little bit more, and whether or not do you see patients in the areas in which you volunteer, and maybe how does this curation help you to potentially better care for your patients? Has it changed the way that you interact with laboratory results or even your patients in general?
So
Go ahead.
Oh, no, go ahead. I don't want to interrupt you. I can
No, please.
after you.
Well, so I could just say this, in terms of my practice, so I see patients in the adult cardiovascular genetics clinic, and I'd say that most of the patients I see, do end up getting diagnosed with some sort of condition that we would call actionable, based on either the ACMG or the ClinGen criteria. But oftentimes these are patients who are getting diagnosed, far within to their disease course, sort of in the traditional manner of genetic diagnosis, which is you develop symptoms, someone thinks critically, could this be an underlying genetic condition, then makes the diagnosis, and then the sort of, treatment happens upon that point. And I think that sort of what I view this effort as is not necessarily directly impacting those patients per se, but really hoping that at some point in the future, that paradigm could shift with some of the efforts that we're doing here, where it won't necessarily be that you actually already have the clinical symptoms by the time you're actually getting the genetic diagnosis, but it sort of shifts to being the opposite way around, when for some of these conditions there are more options available for the treatment to sort of prevent some of these long-term sequelae, or to in terms of cardiovascular genetics, theoretically prevent the sudden cardiac death or arrhythmia that may have a significant clinical impact on that patient. So that's kind of where I view it. It's not necessarily a direct impact in terms of the patients I'm seeing, but I'm hopeful that it will help sort of shift this paradigm a little bit, as we move forward over the next, decade or so.
Well, I appreciate that you kind of highlight that perspective of, rather than at the diagnostic, at the predictive level, can you think about this ahead of time for individuals where maybe they know there's inheritance, and can you look to see this diagnostics and lead them on a course, right, that could maybe better help their outcome of their disease, or even treatment. Hopefully, our fingers crossed for some of these in the future. Great. Rashmi, how about you?
Yes, so so the field that I work in heme malignancies, I guess MD Anderson is kind of the hub for most of the clinical trials that are kind of started here. And our patients also come from, many of them have been treated elsewhere and failed the treatment and come here. So when we kind of sequence the patients, we perform routine sequencing on every patient that comes through MD Anderson. And we see some of the variants that are super rare. Like we don't know how to interpret that. And I think that's when ClinGen has become the go-to resource for many of our lab folks, our students, everyone, to kind of look up ClinGen to see if this has already been curated. If not, we actually go through the literature ourselves, which is essentially curating, and then contribute to that. In addition to that, since I am kind of, so that's what we do with the targeted sequencing. And in terms of heme, it's kind of extremely important because I think in the last 3 to 4 years, we've seen a lot of FDA approvals for the AML therapeutics, MDS, as well as CLL conditions. So I think the decision, identifying these variants, like appropriately categorizing them, has extreme value. It's basically deciding whether the patient gets that therapy or not. So it's really important to be as thorough as possible in interpreting these variants. And although majority of the studies have been performed on hotspot mutations, there are several variants beyond that we sequence. And that's where our expertise and ClinGen's resource comes into picture. In addition to that, I'm also like the lead of the clinical pathology core for the Moonshots program for the AML MDS at MD Anderson. And there we are performing widespread, whole exome, whole genome sequencing. And there are all of these variants that are generated. Again, kind of that is under the research basis, where many of them will be discovered and further, investigated, and then in the future, many of them can be targeted, hopefully.
And it sounds like, in part of the work where you're identifying these very rare variants, is it ever a situation where you're able to kind of think or talk with your patients if they're willing to share their data, so that this could be something where it helps to identify more individuals and more literature?
Absolutely. We are very much into collecting data from patient samples, provided they have given the consent. And we have a centralized database, and we publish multiple publications that come out. I think those are very resourceful for those would be resourceful once they're out there, definitely.
Great. Well, thank you both, Rashmi and Andrew, for your time. We're going to move through to our two other sets of contributors. And again, if we have some time or questions at the end, we'll bring you all back on. Thank you so much. I'm going to move over just very quickly so that we can introduce our next individual here. And this is going to be our international contributor, and that's ClinGen, who is a geneticist at Vinmick Research Institute of Stem Cell and Gene Technology, and also participates in the Intellectual Disability and Autism GSEP. Thank you, Keen, and welcome. I know that this is a very late time for you because you are joining us from Vietnam. And so that is one of the things we want to hear from you, is just how many, if you can tell us briefly about yourself, your volunteer experience, and how long you've been participating in your group.
Yeah, hello. Now it's almost 2 a.m. in Hanoi time, a little bit late. So my name is Kien. I'm a genetic researcher based in Hanoi, Vietnam. So I got my PhD in molecular biology. And I studied some, autism and intellectual disabilities, including cerebral palsy and also others genetic human disorder disease. So I'm working on whole exome sequencing and whole genome sequencing in order to better understand the etiology and pathogenesis of the disease. So yeah, I often work, work with NGS data, do the analysis and interpretation. So every time I fight with the VUS, unknown of significant variants, it's really headaches, because, so I work with a patient, sometimes they wait for months to know the results, and the result is the VUS. So what can we do? How can we suggest to the patient? So in those cases, it's really painful, so that's why, I think is the genetics consultation is really important, to give the patient accurate results to assist a diagnosis. So from that, we can, provide better management and treatment for the patient. So I joined ClinGen from last year, December, during the COVID pandemics. So, I often search for the gene or variants from the database, and like ClinGen or MIM. So one day I found ClinGen accidentally. And I feel sorry for myself that I didn't know it earlier, because it helped me a lot, sometimes I spend a lot of, time for looking for the genes or the variants that from the genetic testing. So the day I found ClinGen, I saw, what I'm looking for. So that's why I decided to join as a volunteer and, to contribute my leader effort to the community. Thank you.
Well, that's wonderful. And we are glad to have you contributing to our community, Kian. And thinking about how you are, basically 11 hours in difference between us, yeah. That is potentially one barrier to your participation. Are there any other barriers you're finding? And, what is the benefit? And you kind of reviewed that, but just, coming over of taking your time to, contribute to ClinGen and attend these calls at maybe very different hours.
Yeah, yes. Sometimes it's 11 hours, sometimes it's 12 hours, So it's the most challenging time, barrier for me to join this, in the nighttime. But it's okay. I learned quite a lot from the ClinGen, how we score the variant, how we adjust the genes, or how we, organize our idea to curate a gene. Is really important, because I mentioned before that sometimes I spend quite a lot of time looking for a gene from all this available database. So one, I learned from that ClinGen, I apply the SOP, and then so it's more comfortable and more easier for me. So I already, introduced ClinGen to my colleagues. And you don't need to waste a lot of time looking around and go to ClinGen and to see whether it's curated or not. If the gene already curated, so you have all information, you can trust the result, you can trust the quality there. So it's better that than looking at ClinVar. Some is pathogenic. Somebody is mentioned that it's not benign or something. So it's better that to go to ClinGen and to see that.
Oh, well, thank you for that
helpful.
praise, Keen. And I just wanted to ask you one last question, is thinking about, do you have any ideas or suggestions or feedback how ClinGen can make it easier for individuals that are coming from different time zones to participate in the expert panels or curation process?
Yes, for the curation activities in our groups, autism and intellectual disabilities, we have 2 steps. The first is a curation, and the next step is a curation. So every time we present our study there, but it takes quite a lot of time, for reading the paper, of course, and prepare the presentation, the talk, and then and present it. So I think it's a better way to have more people to join by assign the people that pay paperwork. So better that it will, especially for the curation staff, we can do the paperwork, so people don't need to present every time. So they need to present in the curation, the final step, And people from, we are not native speakers, so we are better at writing and reading than speaking. So many people is not able to speak too much, so they're afraid. They're afraid even their knowledge is good, but they better at writing and reading than speaking. So I think if we want to more people join, so we need to encourage the people to do the paperwork, like reviewing the journal paper, and submit to the coordinators or the leader, the group leader, and other member can see how the work is going on, and we just need to present the final step. So we can save more time. You don't need to, many people don't need to go to the presentation for the curation. Of course, the curation is important, so we can present it. So I think it's that the way we, can encourage more people to join it.
Oh, well, thank you very much for those feedbacks and suggestions, Keen. We're going to move to our last set of individuals, and then if we have time, we'll bring people back on. I just want to show this slide really briefly, and then we'll move on to the questions. For our long-term contributors, now we've heard from Siebel Kamrachi from the Senior Director of Cytogenetics and Genomics at Quest. And we're also going to hear from Lucas Branagh, who is the Associate Head Scientist from Clinical Genetics Laboratory at CHIO. So thank you both again for joining us. We'll let Lucas just introduce yourself a bit, and then also from Siebel, just hearing from you how long you contributed from ClinGen, since you are both very long time and we've heard your wonderful introduction earlier.
Hi, Courtney. Thanks for having me. I'm Lucas Branagh. Like Courtney mentioned, I'm a clinical molecular geneticist at CHIO here in Ottawa, Canada. And I'm also an assistant professor, and I focus on reporting and improving diagnostic testing for cardiomyopathies, aortopathies, and myopathies. I've been involved with ClinGen for over 6 years now. I first found out about ClinGen through some colleagues that were members, and I thought it was a fantastic initiative and a very vital initiative. And currently I'm spread pretty thin. I'm part of multiple VSEPs and GSEPs. I'm part of the cardiomyopathy, FBN1, and limb-girdle muscular dystrophy VSEP. And I'm also part of the hereditary cardiovascular, dilated cardiomyopathy, and limb-girdle muscular dystrophy GSEPs.
Wow, that's a great amount of effort. And Siebel, do you want to tell us how long you've been with us again, just to reiterate your commitment that you've had for ClinGen?
Sure. Again, I am sorry for the early jumping because I didn't have good internet connection and I thought you call my name. So I jumped very early. For the ClinGen, I mentioned before, I am two different group. For the dosage sensitivity group, I joined around 2011, a contribution. And for the interpretation guideline, I joined 2015. We created right after the curation team. We met in San Francisco, roundtable style. We talk about how can we create a new guidelines. It was late 2015. So since then, I am actively joining these two committees and neurodevelopmental disorder subgroups. And everything so far fantastic because being part of the genetics and genomics committee family member, I feel myself family member here. And whoever I meet with the students or whoever interested in ClinGen, I said it is the best environment for the improvement of our personal skills, curation skills, also creating great networking.
Oh, that's great. And it kind of sounds a little bit like the question I asked, but just thinking about how this long-term experience has enriched both of you. Has it increased your knowledge? Has it increased your networking or just opportunities to present papers, presentations, or even manuscripts and publications that way?
Maybe I can continue. Yeah. So from whatever items you counted, all of them applies for my situation. It created wonderful networking and also great opportunities for the abstracts, publications, and potential presentations. And several institutions, they consider your expert view, and for that reason, they invite you for the institutional presentations, some national and even international talks, and also providing wonderful communication and brainstorming, and it improves every day my knowledge. And so I think number one is the knowledge improvement, and second networking, and the third publications.
Great.
I would echo that. I mean, ClinGen has been fantastic to me in my lab on many levels. But I would say for the knowledge part, it's so valuable. It allows our lab to rapidly adopt these dynamic guidelines, whether we're talking about variant interpretation or novel genes that are curated. So that has been a huge help for us. And also the opportunities have been fantastic, not only for me again, but for my lab as well, the students, the genetic counselors, the various opportunities to present, to be co-authors on publications, or even on posters. So it's been fantastic. And then networking has, I've met so many fantastic individuals that are interested in the same fields as I am. So it's been a great opportunity for that.
That's great. And thinking about the time that you all have both committed here, just wanting to know what changes, whether positive or negative, have you noticed with the consortium and your expert panels or working groups over time?
From my perspective, it is positive change happening. For example, before as a copy number variance group, we were more mainly focusing for the big deletions, duplications, and then so separated from the maybe variant sequence curations. However, slowly we are merging. When we think about the copy number variance, we are getting information through the sequence variance group. So we are getting much more organically connected. So this is the good way for the expert panel. I can mention this one, and then I will let Lucas talk.
Yeah, for positives, I mean, ClinGen has grown tremendously in the past 6 years that I've been part of it. And for the positives, I would say that the growth has been great, and And with the growth has come increased and improved organization and specialization, especially into the different genetic disorders. So for instance, the protocols have become better. The website has become more useful, almost week by week, it seems. And I like, the different editions. So I like these different networking events that are happening now through ClinGen. I like the awards that are coming along. I think that's going to motivate individuals to participate more. So those are some of the positives. As for the negatives, there's very few, if any, negatives. But one that I would mention that we've experienced from our mid-sized lab is that it's become quite resource intensive. Obviously, this is on a volunteer basis. And although I and several members of my laboratory are interested in participating, we don't always have the time to participate. So that has become a bit of an issue sometimes, but we find ways to do it, to manage, because we do enjoy the work.
And also, I would like to include about increased subgroups. Before, so many participants, we were joining the same one group, and the number was huge. Later on, we make decision to create the subgroups, less number individuals. So also, I think it is the positive improvement. Everyone focused on their expert area. For example, a dosage sensitivity curation team, it was before only one group. So later on, it created neurodevelopmental disorder or recurrent CMEs, that kind of subgroups, also positive way. People can focus on the certain areas much deep level.
Oh, that's great advice. And then what would either of you do, or what can ClinGen do you think, to encourage volunteers to stay for a longer term, as both you have?
Sure. Already from the beginning, ClinGen is very supportive for any new members and continued members. So when I think about for the recruiting new people, already this retreat is fantastic way. So introduction about what the curators they are doing. For example, we can create some educational videos. Maybe one session during the curation, we can record this curation video, and then we can do maybe YouTube videos or maybe publish in the ClinGen to see what is going on during the ClinGen sessions, what kind of contribution. Because sometimes when we say that we are expert panel contributors, so many people, they don't know what's going on. Maybe quick demo level video can be very helpful. So this is one of my suggestions. Again, increased number of webinars, a retreat, maybe not once a year, maybe 2-3 times a year. Same thing, workshops, active workshops. They are my ideas.
Oh, thank you, Siebel.
Sure.
Yeah, I would agree. I think more of these networking events, these conferences, retreats are very useful. Again, I'll repeat the awards. I think they're going to be valuable to individuals. Something that they'll enjoy. If a radical plan is needed, which I don't think it is, because I think the rewards of participating in ClinGen are self-evident. But maybe a point-based system where individuals can log in, whether it's hours or however it's done, where they can use those points for merchandise or registration fees for conferences and so on and so forth. Maybe that could be one approach to
those are really, yeah, those are really great suggestions.
And also we discussed this one with our group, with Aaron, creating each curation gets some credits, CME/CEU credits. So this is also where it provides the encouragement, because after this one, you are already getting it for the kind of maintenance of your certification. It is big plus.
Yeah, great. Thank you for pointing that out as well. We did, at least start this with doing the gene curation to get the CME and CEUs. And we really do hope within this next phase that we can expand that out to all the curation activities. So again, another way to potentially motivate individuals to participate, and then also knowing that their time gets rewarded with these different certifications where it's appropriate for them. Well, we do have about 5 minutes if we can bring all of our panelists on, and I will look to see what our question and answers are and just be able to ask you all to attend. And I think some of the questions we had earlier were just, how do you all make time? And I think some of you have kind of answered that. But if any of you have not answered that question and have any other advice about what you do or how you may use that for any of our audience, that would be great.
Maybe I can start again. When I got any curation gene or locus, first, I am spending one day to get the publications. So I am just looking at the PubMed, get all those publications and create a personal folder. For each gene or area, I have an individual folder, put all those publications. And right now, another day, I know all those data available. I go through the potential publications, make the priority, which one much more important. So after this prioritization, I am just going to step by step. So instead of doing everything at once, I am just splitting the time or dates. And after the publication, going through which one important, after I eliminated certain numbers, maybe 3, 4, going deep detail. So altogether, I know it takes more than 3, 4 hours, maybe more, sometimes it depends on the complication. However, after complete your job, you feel so satisfied, and then it improves your also daily activities. You can handle better for the similar cases.
Oh, great advice. Thank you.
There's another thing that I found with my experience, I guess limited experience compared to a few panelists here, is when I'm curating the paper, since it would have multiple variants and multiple gene mutations in one study, if I curated for just that particular variant, and when I try to do it again for the rest of it, I kind of forget. So I try to kind of submit all the evidence items at the same time. And even if the others are not pertinent, in the hopes that eventually it will be useful to say some other recepts. I found that to be much more efficient than curating for one specific variant.
Well, that's some other really great advice. And I know we had one question coming out of just a point when we think about our international contributors of whether or not looking into translating some of ClinGen's materials to multiple languages to increase international access, and, wanting to say with King as our international representative, but any of you that could be international, right? We have multiple of you that are not from the US, if that would be useful, activity or be helpful in any way. I think they're going through typing an answer. So we'll just kind of take a look at that, and certainly understanding it's a lot of SOPs and things to go through, but we've already heard suggestions even of demos and just videos. So maybe visualization of what's happening can be very useful, besides just being able to read or have something in English to, provoke learning in a different method there. Well, audience, please don't be shy. You have all of these contributors and their perspectives here to get from them, but we also thank you all very much for your time, and not just you all as panelists, but really to all of you in our audience and out there for ClinGen, the 1,700 plus individuals. We could not be here without you, and we are very grateful and thankful that you take your time to be able to contribute to this resource. It's what makes it what it is and helps to drive that data and to really become a looked at and top resource around the world. So thank you so much.